Queen's here in Kingston had a medical school at that time. It was one of the first academic endeavors of Queen's University writ large. And they would come to get their education here. A lot of it would be book-based learning at the time with lectures. The students at Queen's, as opposed to those in Toronto and Montreal, which were other centers of learning, tended to be local. They tended to come from farms, and they tended to return to that kind of practice when they graduated. They paid for their learning by paying so much for each course that they took. So rather than having an annual tuition fee, they paid a little bit for each course. And we are very fortunate that we have all of the calendars that laid out what the students should be learning. So not only do we know what subjects they were taught, we also know what books they had to buy or read. The medical school had a small library though, because the books were expensive and students couldn't necessarily own their own. So the professors would come in and give a lecture on a certain topic, and the students would be required to learn these things. We also have a few of the examinations they were asked. And in a time traveler kind of way, it is also fun to go and look at the question and then think how the correct answer has changed through time. A typical class would be a lecture. By the time Queen's Medical School was founded, the trend in both Europe and the United States was that medical students should see real-life patients. They should go on the ward. And so part of the education would require an afternoon or a morning where they would go and attend patients related to the subject that they were learning at any given time. And the expectation was that they would be welcome at Kingston General Hospital and also at the Hotel Dieu Hospital as well. These things were a matter of pride for the medical school at Queen's, that they did have a general hospital, that it had been operating for a long time, and that the professors who taught the students were working there. So mostly they had lectures, but then it would be amplified by being able to drop into the hospital and see a sick patient. Often when they saw a sick patient, they didn't work them up in the way of how we do today, where the students are junior interns or what we call clinical clerks, and they go and help in the care of the patients. Mostly the patient would be demonstrated to the students. So the students would have had a lecture on this topic, and then the professor would introduce them to the patient and point out various signs. The professor might interview the patient a little bit. What does it feel like to have this, or what does it feel like to have that? But the students would stand back in a cluster and look and observe. I've done a study on access to medical education, which was published some years ago. My main target was how much it costs, and it was not cheap. It was expensive for families to send their children to medical school, but the getting in part, the academic record that you needed to be admitted, as long as you could afford the fee, was actually quite easy. And we believe, we don't have the records of everyone who was rejected. So we can't say in absolute numbers what your shot was at the chair, at getting a seat in the medical school. But we think it was probably 1 in 2 were actually admitted, maybe even more than 1 in 2, as long as they could pay the fee. So over the course of time, the fees proportionately descended until quite recently in the 1990s, when they took an astronomical turn upwards. But as they relatively descended, the expectations of what the students needed to have in terms of education prior to medical school increased dramatically, so that now in our time period we have thousands of applicants for just 100 seats in our medical school. It's not quite correct to say that we didn't have professional nurses, in that we had people who worked as nurses and who were paid for it from the time of the very first hospitals, because a hospital can't function without people to clean it, people to lift the patients, people to do the laundry, people to dress the wounds, and they would be paid a fee. But the profession of nursing, and by that I'm referring to the idea of professionalization, where there is a formal education and there is a formal examinations and licensing, and an identity that is established and becomes autonomous and self-controlling. That didn't come until the 1870s for lay people. So there were nurses, and it is also wrong and unfair to insist that they were all bad, evil people who were drunk. Although I've seen draconian histories that go around making these claims, I think that most of them were very well intentioned and tried to comfort the sick as best they could, but they didn't have the formal training, they didn't have the education. When you think that Florence Nightingale made her big incursions into nursing education with the Crimean War, that really laid the foundation of nursing as a formal profession as we know it. And then her school in London, England. Most of the lay schools for nurse training came after her school and on that model. And Canada didn't get one until the 1870s. The support of hospitals was almost arbitrary prior to the 20th century when we made it a matter of government. It was more a matter of civic pride because hospitals inevitably were charities. They were not money-making propositions, and the people who occupied the hospitals were largely the poor who couldn't afford to bring the doctor to their bedside in their homes, and so they weren't likely to be able to pay the bill, although records were kept and we know what it cost for a bed and what it cost for a day in the hospital. But this tab had to be picked up by the local community. And cities took great pride in the hospitals that they had. And we must not neglect the importance of the religious orders that founded hospitals. At least half of the hospitals were religious in nature, Catholic hospitals, and they were an object of philanthropy through the Catholic Church, staffed by nuns who had taken a vow of poverty. Therefore, they were not making lots of money while doing their charitable work very carefully. But communities tried to have a hospital, and there would be pressure. Sometimes there would be a tragic situation that had happened and somebody had died, and then an initiative would come along that we need a hospital, and subscriptions would be taken to build that hospital so that the community would be more attractive one by one. It wasn't till the 20th century when hospitals fell under the jurisdiction of provincial governments and more or less received income from those jurisdictions, so that it was the citizens of the province that was paying for it collectively rather than just local municipalities.